is Nattaly Valentine, and I am a Medicare agent here in Power Brokerage. In today's video, we're going to talk about short-term home health care. This is a very interesting topic that it will definitely help tremendously for a lot of people. Let me tell you, I have done this since 2015, and what I have seen is when I explain to the customer about how this plan will help them, I have to read the summary of benefits, and I'm pretty sure that some people do that as well, but I just want to make sure that to tell you that when you are talking to an agent, tell them that you want to know about the summary of benefits, because that definitely going to help you a lot. What is a summary of benefits is like it just narrow down every single service that is covered to the plan. Some people call it the evidence of coverage because it's actually how the plan going to work for you. So it is very good that you know exactly what you have, so that way you can potentially use every service that is on the plan. So because if not, next year what they do, they can cut some benefits for you, and we don't want that. Nobody wants to go through that. So, but in today's video, we're gonna talk about short-term home health care. As you know, Medicare does not cover too many of home health care. Home health care is when, let's say that you got a condition, or let's say you have surgery done in the hospital. You can be hospitalized for 7 days, 3 days, which is now the commonly is like 3 days, or they give you an observation period. And because they know that some insurance, if they charge 3 days, they can get away with a lot of, the customer have to pay a lot of co-pays for that, so that way they can receive more money. So that's why, that's a FYI, what a lot of hospitals are doing in these days, in 2019. So what will happen if you see in the summary of benefits, right? That's a paper that you're supposed to receive once you are enrolled. That paper you're supposed to receive it like 10 business days after you enroll, and it's a summary of benefits. So over there is something very important that you will see that's inpatients hospital. So you will see normally they're gonna charge you per day. And what I have seen is like you're gonna pay a copay from day 1 to 5 or from day 1 to 7 or 8. Okay, so what will happen is like if they put $285, for example, you're gonna pay $285, which is a lot of money, per day from day 1 to 5, if they say, or from day 1 to 7. So if is that the case, so is I just want to do the math for you. So it's 285 times 7, or 285 times 5. So that would be like 1,000, probably 300. That's what you are going to be responsible for the hospital stay. And let's say if you get again hospitalized, that's again what you have to come up with. You have to still keep paying that amount, because it's a copay. It's a first dollar amount, so it's not a percentage, and it's per day. So now a lot of people say, well, $285. Well, I got hospitalized last year, so I know for sure that probably I'm gonna be hospitalized this year, but that I don't like it. They like the whole benefits, but they don't like that part because they consider that it's a lot of money to be hospitalized. Now, if that's you, because I have a lot of people asking me that question. Like before, we didn't have anything to offer. None of the company had it. But this year they come up with something that it helps a lot of people. And actually they call it a short-term home health care. Okay? This actually, let's say that if they send you from the hospital, they send you to home, right? And then they think that you are ready to go home, but you cannot like walk, you cannot do your regular things, right? You still need maybe a nurse that come to your house and clean the wounds or help you with something. And what happened is a lot of people depend on Medicare and think that Medicare covers that. Medicare covers just a portion of it, and really it's not that much. You have to be responsible for the whole thing in some cases. So this is what it helps, the short-term home health care, and actually it's just one company who offers that at the moment, and it's GTL, okay, Guarantee Trust Life Insurance. They call it GTL. So that plans, it also gives you another benefits, not only just for nurses or physical therapy that you would need for them to go to your house, but to potentially also reimburse you for every medication that you're paying right now. So let's see, probably you are in a medication that you don't pay anything, it's $0 when you go to the pharmacy. Guess what? With this plan, GTL, they reimburse you $10 for generic, even though you don't pay anything. So it's $10 for every generic medications that you will receive. And also for the brand drugs, which are not generics, they pay you. It's even like $25, $30 per prescriptions. So potentially they can reimburse you like $600 in a year just for your medications, which is crazy because nobody else are doing that. And that calls the short-term home health care from GTL. So if you have any questions regarding that, they have a set amount which you can use for, let's say they give you $600 for you to use to pay the nurses that go to your house, or your people that do the therapies, if you have a knee surgeries, to move your knees and all that, so until you are capable to walk. They give you that an amount so you can just get that done, and that way the nurse or the specialist can be paid for it. And if you have any questions, again, this is a basic video, and I encourage you to watch the other videos because definitely will help you save so much money. And again, my name is Nattaly Valentine. If you have any questions, call us here in Power Brokerage, and we'll be more than happy to answer any questions that you may have. Thank you, and I'll see you next time. Bye.